Hello, my name is Anthony Cavallaro, and today is Monday, December 20th, 2021, and I will be attempting to explain the reasonings behind cases 2, which has those three scenarios, and cases 4, which talks about the deficiency of some sort of vitamin or some sort of essential material in purine and pyrimidine synthesis. So let's start with case 2. Scenario 1 in case 2 describes a 9-day-old girl who tests positive for branched-chain amino acids despite no genetic history similar to such. The most likely enzyme deficiency of this girl is that of branched-chain 2 keto dehydrogenase, which is also an indicator for a disease called maple syrup urine disease, which is an inherited autosomal recessive disease. This deficiency leads to the buildup of 4 amino acids as the branched chain to keto dehydrogenase is an enzyme, and those 4 amino acids are leucine, valine, isoleucine, and alloisoleucine. This buildup could also cause a deficiency of acetyl-CoA and propanil-CoA, which are important in the biosynthesis of fatty acids, whereas valine is essential for proper function of neurotransmitters. Because this deficiency is one that affects the catabolism of these branched-chain amino acids, it's important to take supplements in order to help alleviate some of the negative effects. Some of these treatments and supplements include glucose addition through IV to fix amino acid levels and to use hemofiltration, or the filtering of blood plasma, to lower amino acid levels. These treatments may be able to help mitigate the buildup of toxic keto acids, which occur due to the fact that the body cannot metabolize the amino acids I've listed above, which are, again, leucine, valine, isoleucine, and alloisoleucine. Scenario 2 describes a 69-year-old woman who was evaluated to have blue-gray pigmented macules over the cartilaginous regions over the ears and sclera. Based on the irregularly pigmented macules, it can be assumed that this patient suffers from alkaptonuria, and this disease is characterized by a deficiency in homogentistic acid oxidase, or HGD. This enzyme is essential to the tyrosine catabolic pathway, as it helps catabolize the conversion of homogentistic acid to acetoacidic acid. This diagnosis could be critical, as this disease typically can cause cardiovalvular disease, which is characterized by myocardial infractions. So essentially, it's very damaging to the heart, and it can have long-term effects with aerobic, anaerobic, and just day-to-day life activities, This deficiency also involves the inability to break down tyrosine and phenylalanine, which can result in the buildup of this homogentistic acid. There aren't many supplements that can be taken to deal with this deficiency, however. Those that suffer from alkaptonuria, other than high doses of vitamin C, along with nitisinone, which helps with the breaking down of homogentistic acid, and which is caused from the buildup of tyrosine and phenylalanine. Although this doesn't necessarily completely alleviate the damages from the deficiency, it does help alleviate some of the disorder. Last, but certainly not least, is Scenario 3. Scenario 3 describes a newborn baby with high phenylalanine levels at 6.6 milligrams per deciliter, whereas the normal average is typically 1 to 2 milligrams per deciliter. So essentially, her phenylalanine levels are very high, which could have a damaging effect to the newborn. This last patient seems to exhibit warning signs of a disease called PKU, or phenylketonuria. This disease is typically characterized by the deficiency of phenylalanine hydroxylase, which is an enzyme that breaks down phenylalanine, hence her high levels of the amino acids. Since phenylalanine is no longer metabolized, the newborn may develop seizures, eczema, and stunted growth very early on, and later symptoms could include neurological disorders and neurological defects, such as inability to learn as frequently or as much as another child. There are 2 supplemental treatments for this disorder, the first being Kuvan, which can help reduce blood phenylalanine levels, thus helping the function of the hydroxylase enzyme, and the second treatment is Palynziq, which essentially is the same treatment as Kuvan, but deals with patients with extremely high phenylalanine levels. So I hope this helped you understand the scenarios and solutions to case 2. We are now going to move on to case 4, which essentially describes an older woman who is experiencing fatigue and numbness. Further examination shows that she has a very low hematocrit level along with megaloblastic anemia. When considering the many different deficiencies that she may have, it can be concluded that she may have a deficiency in vitamin B12. This is due to her many symptoms that she has presented. One symptom that she has presented is a low hematocrit level, which is indicative of this deficiency, as a deficiency in vitamin B12 leads to lower levels in the hematocrit, along with lower levels of hemoglobin. Her other symptoms include numbness, balance loss, along with being tachycardic to 100 beats per minute. Vitamin B12 deficiencies typically exhibit those of anemia, which include the symptoms presented by the patient along with their diagnosis of megaloblastic anemia. She does not have an iron deficiency, as her iron levels were normal when surveyed. She also has nerve issues, which is not typically indicative of an iron deficiency. She did not present any paleness or trouble sleeping as well. Lastly, she does not have a vitamin B6 deficiency, as she has not presented a weakened immune system, depression, or confusion, which are symptoms of the deficiency. A vitamin B12 deficiency or folate deficiency can be very damaging to purine or pyrimidine metabolism, as it is a necessary cofactor in the cellular process. Vitamin B12 deficiencies actually halt the synthesis of pyrimidine bases, as it is an essential cofactor for methionine synthase. This enzyme is crucial in the conversion of homocysteine to methionine, which can be used to convert methyl THF to THF. So essentially, because this conversion cannot happen due to the essential vitamin B12 cofactor being inactive, pyrimidine bases cannot be synthesized during the many different phases of DNA synthesis. So essentially, although she may have levels of vitamin B12, it's not acting as a cofactor to be able to set off the aforementioned enzyme. So what's happening is her body is not able to synthesize pyrimidine bases, which in turn is not allowing her to go through the steps of DNA synthesis, replication, transcription, translation, etc., which is damaging her and maybe causing her many symptoms such as megaloblastic anemia. So essentially, because of this, she's not able to go through the many normal cellular processes as another person. So yeah. And last but not least, there are quite a few different kinds of testing that can help diagnose the patient with a vitamin B12 deficiency. The first of many tests that could assist in my differential would be a complete blood count, or CBC, which helps to determine B12 serum levels. This would ultimately lead to anemia diagnosis if the patient is not metabolizing the vitamin properly. The only thing to really note about the CBC testing is that although it does work, it can't necessarily show if she has that deficiency. The only thing that can really say is that she may have a blood level that is indicative of anemia. So the next step would be known as an MMA test, or methylmalonic acid testing, which measures the methylmalonic acid levels in the blood and urine of a patient. Essentially, what it's testing for is high levels of MMA, which is an indicator that the body does not have enough B12 in its system. MMA is produced instead to help counteract the deficiency of B12. And last but not least, the final test that could assist in my differential would be homocysteine testing, which essentially is the measure of the amount of homocysteine in the blood, so the product that should be broken down. And if the homocysteine levels are high, that means that vitamin B12 is not breaking down homocysteine regularly, indicating a deficiency. So thank you for listening. If you have any other questions, please feel free to email me or check out one of the many references attached to the bottom of the manuscript. This class has been great, and these case connections have really helped me understand how to analytically respond to difficult prompts. Happy holidays!